Cutting-edge breast cancer research is currently taking place at the Queen Elizabeth Hospital in South Australia in the areas of prevention, treatment and ultimately finding a cure for this devastating disease. One of the recently appointed researchers is Professor Andreas Evdokiou. He is the Michelle McGrath Professor of Breast Cancer Research and has been awarded $1.25 million over 5 years from the Hospital Research Foundation. He'll undertake his incredibly vital breast cancer research right here in South Australia. Here we chat to him about his research area of interest and what it means for the thousands of women and men who suffer from the devastating impact of breast cancer every single year.
So first of all, Andreas, tell us what cancer is.
Alright, well, cancer really is a disease in which our normal cells in our body, because of mutations, they lose control, the way that they control their cell division, the way they grow. And that leads to uncontrolled cellular growth, leading to a mass, and this is basically what tumour is.
And when a mass starts to appear and grows, what is the problem with that?
That's a very good question. More often, it is not really the primary tumour that actually kills patients. That you can always resect by surgery or chemotherapy and so on. But really, tumours become a problem when they start spreading to distant organs, such as the liver, the bone, the lung. Well, we have come a long way in the treatment of primary disease, that is when cancer still is in the breast. The same cannot be said about tumours that have actually spread. Now, my particular interest and the focus of my research really is when cancer moves away from the breast and spreads to the skeleton. When cancer moves to the skeleton, it can really lead to some very debilitating clinical complications that can really erode the patient's quality of life. And bone metastasis leads to bone pain, leads to an increased risk of fracture, of course. Because of that skeletal fragility, the spine can actually collapse, impinging on the nerve, and that can be problematic for patients. More often, these sort of side effects require extensive surgical intervention to actually fix them. And that gives us quite an enormous advantage in being able to access some very precious clinical material from cancer patients that we could use for our research. And it's also important because not every cancer is the same. Not every cancer of the same type in different patients is the same. So we need to be able to understand what their cancer is going to be responsive to and custom-made therapies for that particular patient that has that particular tumour, and that's very important. I come from a very big family. My wife comes from a family of 10 people and I come from a family of 5. We have an extended circle, and just like you and most of others, I have also been touched by other people that I know, other relatives, close friends that have been suffering from breast cancer. Absolutely, I think we should always have that in mind, that at the end of the day, our research has to be applicable for the benefit of cancer patients, and that will be our ultimate aim. I have been in cancer research for a few years now, and it never ceases to amaze me when I speak to cancer survivors or the ordinary people, how switched on and how enthusiastic they are about the type of research that we do. Being in touch with many cancer sufferers, and I've said this before, that one thing that really connects them is hope. Hope that maybe today, maybe not today or tomorrow or the day after, there will be a cure. There will be the next best therapy for them that will improve their life down the track. I think that in the not too distant future there will be new technologies, up and coming technologies. There is an increase in momentum in breast cancer research, and with the new technologies we can only hope that we will be able to finally find a cure for breast cancer.